Welcome to the Effectiveness of Occupational Health and Safety Regulatory Enforcement. We're glad you're here. My name is Angie Hunt, Project Manager with the Canadian Institute for the Relief of Pain and Disability, and I'll be moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program through the BC government, as well as donations and memberships to CIRPD. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing and to ask any questions you have related to the presentation. We will collect the questions submitted through the presentation and follow the presentation with a Q&A based on the questions submitted. Following the webinar, any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website within a week, along with the slides. You'll be emailed the direct links for all these items when they're available. As I mentioned, my name is Angie, and I'll be moderating the webinar and Q&A session. Our presenter today is Dr. Emile Tompa. Dr. Emile Tompa is a senior scientist at the Institute for Work and Health and co-director of the Center for Research on Work Disability Policy. His research interests include the consequences of occupational health and safety system design on the health of individuals and populations, the economic evaluation of workplace interventions for improving the health of workers, the economic burden of adverse health conditions and disability, and the analysis of work disability policy systems. And now I'll turn it over to Emile.
Okay, well, thank you, Angie, and thank you all for joining us. It's a pleasure to have this opportunity to present this study to you. It's something that we had completed last year and was published in the American Journal of Industrial Medicine. You'll see the citation at the bottom of this slide. It's an evidence synthesis of what we describe as the quantitative literature on regulation and its enforcement. There is that qualitative piece that was done at the same time that I cite in a subsequent slide if you're interested in knowing more about that publication. And there was a number of people involved in this initiative, including myself, and they're listed here as co-authors of the study. So just to give an overview and rationale for undertaking this study, it's about regulation and its enforcement, as I've described, and it can take different forms across jurisdictions and over time. One of the things we are particularly interested in is how regulation works or doesn't work, or when it's effective, and how effective it is, given changes that we're seeing in the labor market, competitive global labor markets, changes in labor market contracting practices, and also the concern about limited public resources to invest in regulatory enforcement. The cost of regulation is substantial, so gathering evidence both on its effectiveness and its efficiency is really critical. And just for example, in Ontario, approximately 43% of the $220 million of the cost of the occupational health and safety system are spent on regulatory enforcement. This is just a breakdown of the different components of that $220 million, and we see the largest component is regulatory enforcement. So just giving more evidence to the importance of understanding how it works, when it works well, and how to do it efficiently is really critical to policy decision making in this policy arena. Just to give a bit of backstory to this study, it is an update on a review we had undertaken in the early 2000s that was published in 2007. So this is updating that evidence synthesis, looking at the newest literature that's published in this area, and we've also expanded it to in various areas to include literature that we hadn't covered before. And I just want to touch on some of the feedback we got on that original publication, which is cited at the bottom of this screen. And these are unsolicited comments that we got when we first put together the report from that original study, and it seemed to come at a very critical time because we got a lot of great feedback from across the country about it. And these are just three examples I'll show in these next few slides about some of the commentary we got back from various people who worked in this policy arena. So this feedback was from the executive director of the Saskatchewan Labor's OHS division at that time, back in 2004, I think is when we first had the draft report of this study and disseminated across the country. Another feedback we got was from Newfoundland. They felt it was really critical at the time that they were grappling with, resource issues about how much resources they needed to do an effective job of regulatory enforcement in Newfoundland. And here in Ontario, the then director of the OHS branch, Ed McCloskey, found this really critical piece because at that time they were grappling with expanding their inspectorate resources, which they did subsequently do. They actually doubled the size of their inspectorate and spoke to this evidence to the need for doing so. And part of those resources were deployed to support what they described as a high-risk firm initiative. That actually, we did do a review of that high-risk firm initiative in a study that was published and led by Sheila Hogg-Johnson. So that's the backstory. In that review, as I mentioned, it was published in 2007. The objective was to determine the strength of evidence on the effectiveness of policy levers that were really focused on employer behavior. We weren't looking at worker behavior. We really focused on employer behavior and incentives in the system. We looked at two, I guess what we describe as policy levers, but two umbrella areas of the legislation. We were looking at insurance premium setting, and it was described as experience rating, providing financial incentives through workers' compensation insurance, and then looking at the regulatory mechanisms and their enforcement. The review for the experience rating was updated in a study that was published in 2012, the part that was on the regulatory enforcement hadn't been updated. That older review covered the literature up to 2003, and we had been aware that this literature was expanding. A lot of new and very good studies were being published in this area, and we felt there was need for an update on the regulatory enforcement component of it as well. So that was the motivation for undertaking this update and expansion of our evidence synthesis in this area. Now, complexity of regulatory enforcement is a critical thing to keep in mind. There's different ways that one might introduce legislation and enforce it. And there could be many reasons why it isn't effective as well. So while we were reviewing this literature, we were trying to better understand also how best to identify where and how it works well and where and why it doesn't work well. So various reasons may be there as to why regulation doesn't work well. It may not even get at the root causes of injury. So if the regulation is focusing on issues that are not the core causes of injuries and illnesses in the workplace, it just won't be effective. There's also the issue of the enforcer's ability to detect non-compliance. So that may be an issue as well. So the inspectors in the field, because they're going to various sites and are only there for a short period of time, are they able to detect non-compliance in an effective way? Another issue is that regulators may be restricted in their ability to enforce compliance. So even if they do identify non-compliance, how effective can they be in encouraging companies who are non-compliant to become compliant? So is that a feasible undertaking given the tools that they have in their toolkit to do so? For one thing, the threat of punishment may not be an effective deterrent. One of the issues is that firms may be very short-sighted. So if they're not inspected, if they don't know that inspectors are out in the field and inspecting, but they themselves do not get inspected, they may not react to the threat of punishment. Sometimes punishment might also create antagonism. So rather than encouraging compliance, it may get their dander up, and they might create an antagonism between the inspectorate and the workplace management and owners. It also may divert attention away from important health and safety issues, because when you're inspected, lots of resources are reported to trying to be compliant if you're found to be non-compliant, and then may take attention away from other important health and safety issues. So various reasons why regulatory enforcement may or may not be effective, and we were looking at this literature trying to understand, when we did find evidence that was good evidence, from the studies, why it seemed to work well or not work well. So to dig deeper to understand that complexity. The mix of enforcement activities are an important thing to think about too. So what is that ideal mix of different tools in the toolkit that work well as a package? It can take many forms. There's education, assistance, persuasion, promotion, some financial incentives, monitoring and enforcement and sanctions, various ways that regulators might try to ensure compliance and work environments that are healthy and safe for workers. each activity contributes towards some aspect of the mission that's to be accomplished of having healthy and safe workplaces. So, but identifying that optimal mix is a challenge, and I describe it sort of as a tangled web of cause and effect. And as researchers studying this area, trying to tweak out the marginal impact of a specific policy lever can be a challenge as well. So that's part of our process of evaluating the merits of the studies we're looking at, that we're focusing possibly on just one aspect of that mix of enforcement activities to understand whether that one particular policy lever that was being investigated worked well or didn't work well. We need to understand, did they do a good job of tweaking out the marginal impacts of the focus that they were giving to a particular policy lever. So that was part of our quality assessment process when we were looking at this evidence base. So on the research side, as I mentioned, how to parse out that marginal impact it is a challenge. First of all, conceptual understanding of the behavior of stakeholders is really important. It requires good data on the measures that on the policy levers that you're investigating. Having an appropriate study design, including statistical methodology and that controls for the context of where the data is from. Sometimes, taking advantage of a natural experiment when some new legislation is introduced, new regulatory activities are introduced. That's an opportunity to evaluate them. Some studies, where not often in this literature, but can randomize to have a control versus a case situation where you can compare a situation where something new is being presented to a control where the status quo continues. So that's another way of testing for marginal impacts of new legislation. Sometimes before and after studies are undertaken as well, and then trying to control for context through statistical modeling. Sufficient measurement is required in terms of time frame to detect effects when something new is introduced. Obviously, it may take time for outcomes to change, for injuries to reduce, for employers to fully initiate, changes in the workplaces such that the exposures are reduced and ultimately there's fewer injuries and illnesses in the workplace. So that takes the time period that you need to cover in your data in order to detect any effects of that legislation, or in regulatory changes. So, and also it requires a deep understanding of what the results mean. So interpreting findings from a statistical model is a challenge in and of itself, and that's really important for us to consider when we're evaluating the merits of these studies. So the overarching question of this review was, what is the strength of evidence on the effectiveness of OHS policy levers in creating incentives for organizations to improve occupational health and safety processes and outcomes? It's a mouthful, but that captures the essence of what we're trying to get at. We're looking at those policy levers that create incentives to reach, which are creating incentives for organizations to change what they're doing in-house. That's what we described as the processes, and also what impact it has on the outcomes. We look at two types of outcomes, actually. We look at what we describe as intermediate outcomes, which are sometimes the end goal of some policy levers to ensure compliance, but the ultimate outcomes are really reduced injuries and illnesses. We've expanded the scope from our previous studies I mentioned earlier. So what we included in this study that we didn't include in the previous study is intermediate outcomes. So we looked at compliance as an outcome, whereas the previous study only focused on injury and illness outcomes. We also included smoke-free workplace legislation, which is an area that has gotten a lot of attention in the early 2000s because of efforts by various municipalities across Canada and internationally to reduce exposure for particularly people working in the service sector, in restaurants and bars and other food service sectors, industries, by legislating not smoke-free workplaces. And there was a lot of really interesting studies in the literature on this topic, and we saw a lot of parallels in this area with other occupational health and safety legislation that was brought on board during this time period and evaluated in various studies. So we took that as an individual kind of cluster of studies, and we'll speak to the evidence base from that cluster in this study. Awareness campaigns were also included, so these are kind of information campaigns to alert employers and workers about health and safety risks in the workplace, particular types of exposures in some sectors that need attention. So we included that literature in this review. And then we looked at the nature of enforcement as well, so looking at what the inspectors did, how often they inspected a particular work site, and how long it took for them work sites to become compliant. So that was a cluster that we hadn't covered in the previous review. So in terms of methods, I have a few slides here on methods, and I'll kind of go through them quickly. I'm not too sure if people are interested in all of the details of how we went about identifying and evaluating and synthesizing the evidence base, but I'll give you just an overview of that process. We had an international advisory committee to guide the process, which we met with them, I think, 2 or 3 times. They provided some guidance at the front end on framing the question that we were addressing through our synthesis, and also identifying, what are the key areas we need to look for studies. And then at the tail end, they would give a lot of good input on the interpretation of our findings. The search strategy was done in conjunction with a qualitative review that we did on this topic, which was a separate study, but the reviews with the quantitative and qualitative was undertaken jointly at the front end, and then it separated out when we had assessment process followed, where we drew on methods and tools that we used in our previous quantitative review, and what we did was what we described as a best evidence synthesis. On this slide, you also see the citation for the qualitative study on this topic that published in a different journal, the Scandinavian Journal of Work Environment and Health. This is part of that group as well. So our search strategy, we used what they describe as a PICO search approach. What P stands for place. So regulatory focus was the kind of the core topic. The setting, we had a number of descriptor terms for the setting, a number of descriptor terms for policy levers, and then the context, which we included both conditions and outcomes in the context category. So those 4 items had a battery of terms that identified those 4 domains, and a study had to have had terminology from each of those 4 domains in order to fit into the list of initial citations that we extracted from various journal databases. The first level of screening looked at just titles and abstracts, and then the subsequent level, we took a deeper dive looking at the actual studies to make sure they've met all the inclusion criteria. And at a certain point here too, we broke off from the qualitative side of it to dig deeper into the quantitative studies to make sure that they met certain quantitative inclusion criteria, which are on this next slide here. So for the quantitative studies, we really wanted studies that had a temporal element to them. They had to have some kind of element of observations over time rather than just a cross-sectional type study, because we wanted to be sure we could kind of discern cause and effect, which requires a temporal element to it. So if it was just cross-sectional, you could see correlation, but you'd be hard to discern causal kind of relationships. So it could be longitudinal or panel type data, or it could be respondents who spoke about issues in over different periods of time within their organization, depending on the study design, whether it was primary data collection or drawing on administrative data or survey data from various sources. We wanted a study design that was rigorous, so we would use statistical modeling techniques or some quasi-experimental design approach to fit into a study that was a good enough quality to be included in our evidence synthesis. And then the study had to consider final outcomes such as injuries and illnesses, or intermediate outcomes such as compliance. I won't get into this slide too much, but it's our assessment, a quality assessment tool where we had 2 levels of assessment. We looked at the overall quality of the study, and then we really drilled down into the quality of the regulatory policy lever that was being evaluated, because that was a critical component of it. So if it didn't do a really good job of evaluating the policy lever that we were kind of focusing on in the study, then it didn't meet our inclusion criteria. So both of those two levels, the overall study quality and the regulatory enforcement evaluation, needed to have a high score of 70% or higher in order to be included in the final synthesis. This slide also has a lot of details. It's our synthesis algorithm, and I'll just focus on the criteria for strong evidence. We required 3 high-quality studies or more in order to have strong evidence, and the 3 studies needed to agree, so they had to have consistent findings in order to be considered an area where we find strong evidence for a relationship between a policy lever and its outcome of compliance or reduced injuries and illnesses. If there's more than 3/4 of the studies needed to agree in order for it to fit into this strong evidence category. In this slide, we just give you a bit of breakdown about the number of citations we identified across different databases. In total, we had just under 12,000 titles and abstracts that we reviewed before we distilled the 40-odd studies that ended up being in our final evidence synthesis. This slide gives you a little bit of a more detail on how that broke down after we identified that first cluster of 12,000 citations. We ended up having 43 studies that were included in our quality assessment. The studies that were deemed to be low quality, there were 21 of them were not included. Only the medium and high quality studies composed our final statements of strength of evidence in the relationship between the different policy levers that we had identified in this literature and the intermediate and final outcomes that were at the root of what they were evaluating. So this slide just gives you a comparison of our previous study that covered literature up until 2003 and the new review that covered literature up until 2013. So we had more clusters of relationships in this newer this updated review, including, as I mentioned, introduction of smoke-free legislation was a new cluster, inspection sequence was a new cluster, nature of enforcement was a new cluster, and also awareness campaigns were a new cluster. So the clusters that were in our original review were looking at reduction legislation, and a cluster that we described as looking at either general or specific deterrent of inspections and penalties. I'll just elaborate on what that terminology means. With general deterrence, what those studies look at is the probability of being inspected. So they look at the industry numbers of inspections that are being undertaken, and how many organizations there are out there, or a certain temporal period, like the probability of being inspected within a given year might be like 5%, and does that have any impact on injury and illness outcomes or intermediate outcomes such as compliance? So it's about the threat of inspection. Does that deter? Does that encourage employers to be compliant or reduce their injury and illness outcomes? The specific deterrence is the effect of actually being inspected and in some cases cited and fined for non-compliance, and that looks really at the specific experience of those organizations that are being inspected by the inspectorate. So that's what the distinction is between general and specific deterrence, and the literature does separate out those two constructs, so we speak to each of those constructs in our evidence synthesis. One thing I just should mention also is that we noted quite an improvement in the quality of studies in this updated of this cluster of studies. And what we found was that more rigorous methodological techniques were being used in terms of the statistical modeling, better quality data that was being used, more longitudinal type studies that had lots of good rich details about the context and the policy levers. So we really noted that there was more high quality studies in this update of the review. So now I'm going to drill down into the specifics of our findings. In terms of the introduction of occupational health and safety legislation, we had found 9 studies that we retained in our synthesis. There was only 1 high-quality study and 8 medium-quality study. And what we noted was that there was a mix of different legislations being investigated. So in some respects, they're not completely comparable. They're all about introducing legislation that focuses on specific issues. You know, one of them was on hearing conservation, another on chemical exposure mitigation, another in the healthcare sector, universal precautions for bloodborne pathogens, ergonomics regulation, log-out, tag-out requirements. So quite a mixed bag of studies here. But we brought them together because they're all about evaluating introductions of legislations that were on top of already a large body of regulatory practices that were already in place in those jurisdictions. Some of them considered final outcomes, such as injuries and illnesses and fatalities. Others looked at exposures and compliance, reductions or increases in compliance. What we found was that there was moderate evidence that the introduction of legislation had no effect on injuries. And limited evidence that the introduction of legislation improved the intermediate outcomes of exposure and compliance. And I'll speak a little bit more about how to interpret these things towards the end of my presentation. But this was a very interesting finding that this body of literature didn't seem to find very strong effects on impacts on reduced injury and illness outcomes. In terms of the introduction of the smoke-free workplace legislation, so this is in some degrees a subset of the introduction of legislation, but a really specific one in which there was a number of studies, and it's generally in a different domain than occupational health and safety regulations. So we put it together, put it in a separate cluster, but felt that it was a really compelling body of literature to speak to, and had lots of common ground with the broader occupational health and safety arena. So we found 6 studies that were retained in this cluster. 5 were of high quality and 1 of medium quality. So the introduction of different forms of smoke-free workplace legislation was evaluated in various jurisdictions in North America and Europe. So it was quite international literature. Some studies considered final outcomes such as respiratory and sensory symptoms, and others intermediate outcomes such as reduction in smoke exposure and reduction in cigarette consumption. And in this literature, we found very strong evidence that the introduction of smoke-free legislation reduces exposures to smoke, and moderate evidence that the introduction of smoke-free legislation reduces respiratory and sensory symptoms. So a very different finding from the cluster I just spoke about. And the context is different. The kind of the situational kind of factors that may bring about effectiveness or lack of effectiveness in the introduction of certain types of legislation is really interesting thing to dig into more deeply, and I'll speak to that again at the end when we think about some of the kind of cross-cluster kind of understandings that we can draw from these findings. So the next cluster is about inspection sequence. So this is speaks to a bit about the efficiency of use of time of inspectors. So there's 4 studies in this cluster, 2 of high quality, 2 of medium quality. All of these studies were undertaken in U.S. jurisdiction. So that's something to keep in mind, because whether or not it's generalized, but it's hard to say because there wasn't studies in other jurisdictions looking at this phenomenon. It considered how inspection sequence influences compliance rates based on changes in compliance and violations cited at a particular organization that were being inspected more than once. Okay, so we found moderate evidence that the first inspection has a large impact on compliance, and then incremental changes in compliance wane substantially in second, third, fourth, fifth inspection to the same employer, same organization. So really that first inspection had a really big impact. Subsequent inspections had very marginal impacts. And so the issue here that comes to light is that is it worth going there a second, third, fourth time? And the evidence here would suggest that it's not possibly a good use of inspector time to inspect the same location more than once. Okay, So the next cluster is on general deterrence of inspections and penalties. This is the threat of inspection that I spoke to earlier on, so the probability of being inspected and penalized. There were 3 studies in this cluster. They considered the impact of the probability of inspection through oftentimes looking at data at the aggregate level, so looking at industry level inspection activity. The final outcomes included were lost time injury rates, lost workdays, and fatalities. And what we found was there was limited evidence that general deterrence, so the threat of inspection, has no effect on lost time injuries at the aggregate level. And also limited evidence that general deterrence reduces fatalities and lost workdays. So no effect on one end and some evidence of effect on the other types of outcomes. But both are limited simply because we didn't have any high quality studies in this cluster. The next cluster is on specific deterrence of inspections and penalties. And we had quite a few studies in this area, 13, and 8 of them actually were of high quality and 5 of medium quality. Most considered specific deterrence in the form of inspections that had or did not have a penalty. So some organizations that are being inspected may be compliant, and so no penalty is put on that organization. Some may be non-compliant. They might have a penalty in order to comply with a specific requirement in a certain period of time, or a penalty of some other sort. So some considered other enforcement activities such as consultations or details of inspection activity, but I'm not going to get into that specific item within this cluster. So what we found was strong evidence of inspections with penalties produce injury. So those inspections that organizations were actually cited and fined for non-compliance had a very, activity and that kind of enforcement activity had a very strong impact on subsequent outcomes. What we found was moderate evidence of inspections without penalties having no effect on injury. So if it didn't have an inspection, the evidence suggests that there is no impact on injury outcomes. And then limited evidence that compliance or review of motor safety performance reduces truck crashes. This was a study that really stood out separately from all the rest because it was in the transportation sector where vehicles were being evaluated for compliance with regulation, and then what happens subsequently in terms of road accidents with that vehicle. And so because there was only one study, we needed limited evidence for that cluster. In terms of nature of enforcement, we found 6 studies that were retained in this cluster, 4 being of high quality and 2 medium. We divided this into 2 groups. One that was about consultative activity, which had 4 studies, and another cluster that had looked at state versus federal level enforcement. And this second category really pertains to the U.S., where OSHA works at 2 levels. Some states have their own enforcement body that takes care of inspections and citations and regulatory enforcement through the state authorities, and some rely on the federal level OSHA body to undertake that kind of enforcement. And they were looking at, in these studies, whether the state versus the federal level enforcement made a difference. And what it really seems to get at in this literature is trying to understand, do local level regulators have a better understanding of what's happening in the field? Are they more effective because they have that better understanding because they're in the field, close to activities, much more than a federal level body, which may be people coming in from out of state to do that inspection and evaluation of compliance. So we found strong and limited evidence on consultations having no effect on injuries. Limited evidence that an autonomy supportive style reduces the number of visits to achieve compliance. So this is about the style of inspection, whether the inspector is more collegial and supportive versus very kind of harsh and aggressive and focusing really on penalizing non-compliance. And this limited evidence suggests that the ones that are supportive of workplace autonomy and having that kind of style reduces the numbers of visits to achieve compliance. And then limited evidence for the state versus federal level, which the state enforcement results in lower fatality rates compared to the federal level enforcement. So from these 2 studies, it seemed that to suggest that state level enforcement results in lower fatality rates. And then one of the other clusters was on awareness campaigns. There was 4 studies in this cluster. The studies were in different sectors and focused on different occupational health and safety risks. One of them was on noise regulation, guidelines on child labor, agriculture, eye injury campaigns, and managerial training programs. So a range of different types of awareness campaigns. Two considered final outcomes and two considered intermediate outcomes. And what we found was there was limited evidence that campaigns reduce injuries and moderate evidence that campaigns improve compliance. Not many studies in each of these subclusters, so it's really not large literature to draw on for understanding those relationships. So limited and moderate evidence across those intermediate and final outcomes. So to just try to pull it all together to get a kind of overview of how this all fits into the toolkit of regulatory enforcement, it is a lot to grapple with. But one of the things that we noted was the introduction of legislation, particularly the smoke-free workplace legislation, suggests that new legislation can work given the right context. The cluster that we had that were on other types of legislation didn't have a strong evidence, but the smoke-free workplace legislation did, and we were trying to think about, well, what's different about that kind of area that made it effective, and yet other literature suggests that introducing new legislation isn't always effective. Well, and some of the things that maybe we all kind of conscious of is that isn't smoking, and secondary smoke is something that is very heightened awareness in broad public media. The concern about this for both patrons who don't smoke as well as the workers in the workplace who are affected by smoke in the workplace has been a big issue in the media kind of thing. So awareness of these issues in the public domain seems to be a big important factor as well. And broad support for doing something about it is also something that might have made this initiative very effective as well. So given that kind of context of broad support, awareness of these issues in the public domain, it could very easily be an effective introduction of legislation, and maybe that's some of the lessons that can be learned for introducing other legislation in the occupational health and safety field, thinking about how we can draw on public support, build broad awareness of these issues, and achieve kind of consensus that something needs to be done about this in the public domain, and awareness of the public and awareness of workers and workplaces in order to get buy-in before going forward with such legislation. Specific deterrence, finding for this is very consistent with our previous study that reinforces the importance of regulators being in the field, citing and finding non-compliance. Being cited and fined as an organization, it heightens awareness for those organizations. One of the things that some researchers have pointed out is the notion that employers and organizations are conscious of inspection activity out in the field, and that threat of inspection may be a deterrent it may be unrealistic. Employers are often very busy, and focusing on issues at hand, sometimes very short-term issues, that putting out fires, dealing with day-to-day activities within their organization. So awareness maybe of what's happening out in the larger field of regulatory enforcement may not be on top of mind all the time for organizations. So only when it hits home through being inspected and cited and fined for non-compliance does it really come home to the organization's awareness to deal with those kinds of issues. So creating that kind of awareness for employers is really critical, and that might be a way of thinking about how to go forward with some of this evidence, is thinking about how to build awareness on certain really important occupational health and safety issues through, maybe very focused awareness campaigns supported through, focused enforcement activity, doing these very heightened focuses on a specific type of issue, so that everybody is aware of that is important to deal with, such as maybe slips, trips, and falls, or musculoskeletal injuries, in terms of ergonomic type issues. So really focusing on issues that you can draw on a campaign to promote awareness, and then go out there and enforce in a rigorous way. Consultations appear to have no effect on injury outcomes. This is a very interesting finding. Particularly, it may have important implications for the moves towards voluntary guidelines that some jurisdictions are going towards. Will these kinds of voluntary guidelines that aren't enforceable through regulatory processes be effective. Consultations aren't quite exactly the same, but suggest that they're kind of more of a coaching type approach to help support better outcomes in workplaces that aren't necessarily required for organizations to support. So we didn't find any studies that looked at voluntary guidelines, so that is most definitely a gap in the literature, but the consultations is the closest thing we have found. And the suggestion is that consultations in and of itself do not have an effect on injury outcomes. Compliance outcomes, what we found was first inspection had the largest impact on compliance, so really important thing for inspectors to keep in mind. Intensive enforcement activities where an inspector goes to the same location multiple times may not really be an effective use of inspector time. Awareness campaigns to improve compliance are an important thing as well, as I've promoted throughout our findings. So that's another area to think about, how to promote awareness, whether it's about smoke-free workplaces or other occupational health and safety issues that are important to address in workplaces. In terms of research, one of the things we really found that was important was the need to create more opportunities to understand what works best and when and why. So understanding context is really important. So that requires collaboration between policymakers and researchers to work together to build those evaluation frameworks into the process of regulatory enforcement, particularly when new legislation is bringing on board or new activities are being initiated within the enforcement activity toolkit. Really important to build in that layer of evaluation, because the good data and seizing opportunities, natural experiments is a really good way to develop some really robust research designs. Particular areas that really important to investigate, because there's not much literature on it, is the investigation of the effectiveness of voluntary guidelines, exploring the context and conditions for successful legislation and policy. I've emphasized the smoke-free workplace legislation and trying to understand why that works well, and trying to understand why other legislations that are introduced work well or don't work well is really important, but it's that context that engenders effective outcomes. Investigating the relationship between also compliance and injury, final outcomes such as injury outcomes is really important. So compliance may be an intermediate outcome that's really important for inspectors, but ultimately what we're trying to do is reduce injury and illness outcomes. So understanding that relationship between being compliant and the final injury and illness outcomes is really important as well, to bridge that link between intermediate and final outcomes. And then finally, to consider the mix of policy levers that are most effective and efficient is really critical. I've spoken to individual policy levers as clusters in the evidence around those specific policy levers, but then there's a need to also step back and think about, well, what package of activities are most effective and efficient? How much inspections and regulatory enforcement with policy levers such as citations and penalties need to be done versus awareness campaigns versus other types of activities. What's that ultimate mix that's the most effective use of inspector time and occupational health and safety resources? We didn't come across any studies that looked at that big picture in the mix of activities, so that's something that really warrants investigation in the literature in the near future. And that's it for me, and I open it up to questions at this point in time then.
Okay, to our audience, if you have any questions at this time, please enter them into the question and answer panel, to the question panel on the GoToWebinar panel. One of the questions that came in, is there any evidence that led to the conclusion that the threat of punishment may not be effective deterrent, or what was the evidence?
Okay, so that was one of the clusters, was the general deterrence. We call that the threat of punishment, and there was, what did we have, 3 studies I think in that cluster. They're usually done at the aggregate level, that probability of inspection, and the probability of inspection, the probability of being cited and fined are identified through aggregate level identifiers or variables from the number of inspections that are being done in a particular sector and how many firms or organizations are in that sector. So that determines the probability of being inspected in a given period of time. And that those those studies generally found that we had 3 in this cluster, but in our previous review, we found similar findings from the older literature that the threat of inspection, the probability of being inspected, didn't have an impact on final outcome. There had very low levels of evidence suggesting there's an impact on final outcomes. So we, in that previous study, we also found limited evidence of an effect of this, what we describe as general deterrence. So the threat itself is not sufficient. Clearly, not every organization can be inspected. There's always going to be some organizations that won't be inspected, but the fact that you increase the probability of being inspected really doesn't have a big impact, it seems, on the behaviors of organizations.
Okay. Another question. What is your thought on strengthening internal compliance as any specific deterrents?
Okay, so internal compliance within an organization is it through like the internal mechanisms through joint management labor committees that customize their activities in terms of looking at what needs to be addressed when and how, so prioritizing that through the joint health and safety committee activities. We didn't have that as a cluster because we didn't come across any studies in this literature that looked at internal responsibility systems. There is only one study that I'm aware of that was done quite a number of years ago that looked at that in the Ontario jurisdiction that did an assessment of the effectiveness of the introduction of internal responsibility systems through joint health and safety committee. So it's not a cluster here, so I really can't speak to that kind of a topic. And I hope I'm understanding the question correctly in terms of the kind of aspect of regulation that the person is asking about.
Okay, if the person has any specific follow-up questions, I'll just ask them to put into the question panel. They said it's fine. The answer was good. Another question, can you talk a little more about the specifics around the threat of inspection? For instance, were there variables that the team saw around the organizations that predicted an impending inspection?
Okay, that's a good question. Nothing jumps to mind about the specifics around how they constructed the threat of inspection in different ways in this literature. Most of these studies, I believe, are based in the US and Canada. We only kept 3 from the most recent review. We had several more in the previous review. Most of them took a similar approach that looked at, from what I recall, had aggregate level data on inspection activity and over a certain time period and how many organizations there were in those sectors and what the probability of being inspected in a particular period were to look at the threat of inspection. They usually were using data from administrative sources or survey data on OSHA activity in the US or jurisdiction specifically. Like there's a study I think from Quebec that looked at this topic as well, using administrative data from the IRSST in Quebec to evaluate the threat of inspection. So generally they seem to take a similar approach, is looking at the probability of being inspected for any particular firm.
Okay. Another question that came in, what is your thought on the effectiveness versus cost to implement regulations considering the limits on the regulator's ability to enforce them, i.e. not enough regulators to visit all businesses?
Mm-hmm. Yeah, that's a good question. That's a challenging issue for regulators to deal with. Obviously, there's more that could be done than there are resources to do them. So really critical to understand what works well, and when, and so how to use inspector time most effectively. The small cluster we had around inspection activity spoke somewhat to that issue about the first inspection being most effective, subsequent inspections not being. The more collaborative type approaches are being more effective than the more authoritarian type approaches into inspection. those two clusters spoke to that activity, but certainly none of the studies really drilled down into measuring the cost of these resources and the value of the outcomes in terms of cost benefit type of framework. That would certainly be an interesting study to do with some of these initiatives, but that would require a lot of collaborative work between the researchers, I guess, and the inspectors to make sure we capture all of the kind of resource inputs into an initiative, and then try to quantify and measure in monetary terms, the values of the outcomes that ensue to society in terms of reduced injuries and illnesses and related costs and benefits to that. And I think that's certainly a direction I think the literature ought to go in, and it's a good suggestion from the person who brought up that question. I really like that idea.
Okay, I think that is all our questions for now. Emile, do you have anything you'd like to add following your presentation?
No, I just would encourage people to also have a look at the qualitative study that is cited also on these slides. It really gives a lot of information about process rather than just substantive findings around the causal relationships between activities and outcomes. So really the process part is really important to understand as well. So that gives some really valuable insights that are different and additive to what we found. So the two studies I think really work together very well, and that's the reason why we did the two jointly, in order to capture very different literatures and different understandings of that whole area of occupational health and safety regulatory enforcement. So I encourage people to pick up both of those studies and read deeply about, particularly in our conclusions, we try to kind of synthesize all of this evidence in a more kind of prescriptive way about what to do going forward, both for policy and research. And I thank everybody for joining us.